Hi, so today I'll be presenting my project on implementing AI in mental health, specifically early detection of mental disorders. Hi everyone, my name is Tanvi Chaturvedi and I'm a rising junior at Urbana High School in Frederick, Maryland. I'm passionate about neuroscience, mental health, and ethical AI use. I co-founded the Ray Foundation, a nonprofit dedicated to supporting youth, especially neurodiverse youth, through advocacy and access. I also serve as a member on my county's Special Education Citizens Advisory Committee, and I've been participating in my county's ISA Science Fair for the past 5 years, doing many projects relating to AI, machine learning, and how that could be incorporated to helping solve mental health and public health issues in my community. Today, I'm excited to be sharing my work on Manasvani, a tool that uses artificial intelligence to detect signs of depression, anxiety, and suicidal ideation from speech, something that has the potential to impact mental health care around the world. Mental health is a global issue, and the way we currently diagnose it presents major challenges. Depression and anxiety are serious illnesses that can impact daily functioning, and in extreme cases can lead to suicide. According to the World Health Organization, over 280 million people suffer from depression globally, yet only 3 out of 4 of them ever get the treatment they deserve. Right now, diagnosis mostly relies on interviews and self-report forms, which are not only time-consuming and subjective, but also often inaccessible, especially in low-resource countries with few trained professionals. Even in high-income countries, however, stigma, long waitlists, and underdiagnosis remain major barriers. This is why we must treat mental health as a global challenge. Anxiety affects nearly 4% of the world's population. Depression is the leading cause of disability worldwide, and what's especially concerning is that these conditions often begin during adolescence. 1 in 5 children globally experience symptoms of depression or anxiety. And yet, most health systems, especially in low and middle income countries, aren't equipped to handle the scale of this crisis. There simply aren't enough mental health professionals, and many people are left without care. This unmet need across borders and cultures is what inspired me to look for a solution that is scalable, accessible, and culturally neutral, something that can be used globally, not just locally. And so that solution, I believe, might come from something that we use all day, every day, our voice. Studies show that people use it, Studies show that people with depression tend to speak differently, using flatter tones, longer pauses, and different rhythms. So I created Manasvani, an AI-based system that listens for those patterns and flags potential signs of depression early on. The name Manasvani comes from Sanskrit, Manas meaning mind and Vani meaning voice, capturing that powerful connection between our mental state and how we speak. So compared to existing methods, Manasvani could help close critical gaps in global care. Today's tools include clinical interviews, which are effective but time-intensive and not widely available, self-report questionnaires like the PHQ-8, which are useful but often biased, neuroimaging, which is really expensive and is limited to wealthy countries, and apps have really been growing in popularity recently, but vary widely in accuracy and accessibility. Self-reports are widely used, but if someone is afraid of being judged or doesn't really even understand what they're feeling in the first place, they may not report symptoms at all. That's why voice-based analysis bypasses that issue. It listens, not judges, and could become a neutral, consistent tool, especially for use in schools, clinics, and low-resource areas. So before I go any further, let me explain a little bit about how this works. Neural networks are a type of machine learning modeled after the human brain. They use multiple layers of processing to identify patterns in data, just like neurons work together to process information in our brains. More specifically, I used convolutional neural networks, or CNNs. These are especially good in finding complex patterns in images. In my case, in my project, those images are spectrograms, which are visual representations of sound. So essentially, I taught a computer to see the way depression might sound. Now let me walk you through what I built. I used an open data set of over 2,500 voice samples from depressed and non-depressed individuals. The database comes from the DIGWAS corpus, a global research resource that contains audio, video transcripts of clinical interviews. I converted each sample into a spectrogram, then fed those images into a convolutional neural network. I tested different architectures, ResNet 18, ResNet 34, and ResNet 50. Each one learned from the data to distinguish between depressed and non-depressed speech patterns. ResNet 34 performed the best with about 70% accuracy using just 15 seconds of audio, promising start for a simple screening. So this slide basically shows the workflow that I just talked about. First is speaker diarization, separating speech segments. Then comes feature extraction, converting speech to visual spectrograms. And finally is classification using CNNs to analyze those patterns and make predictions. All this can be done quickly without the need for a clinician to be present, making it scalable across continents. And so the accuracy and F1 scores show how this approach works, and that with more data and model tuning, it could become even more reliable. But even now, it shows promise as a first line screener, especially in schools, refugee camps, or rural health centers where access is limited. And so this also shows our results, how we achieved 70% accuracy for the 15 seconds of audio. So now, as promising as AI is, it must be used ethically, especially in global health. There are 4 key principles that we must follow. First is justice. AI can help close gaps in underserved regions, but only if we train it on globally diverse data. Next is autonomy. People must consent before their voice is analyzed because transparency is really key. Then beneficence. AI should improve lives, and that's why early detection will therefore save lives. And finally, non-maleficence. Misdiagnosis can cause harm, so human oversight is essential. When used responsibly, AI can support, not replace mental health care. And so that leads me on to my next slide. Can AI replace therapists, psychiatrists, etc.? So now AI cannot, and it's not here to replace therapists or psychiatrists. A computer can recognize patterns, but it cannot replace human empathy. What Manasvani does is flag risk early so that therapists can intervene faster and people can get help sooner. But what if it fails? That's why we need global ethical standards. Developers must ensure diverse, accurate training, health systems must regulate its use, and clinicians must always verify and interpret AI output. Only with shared responsibility can we safely bring AI into mental health systems around the world. In closing, I want to thank my mentors, my teammate Anvi, the Ray Foundation, and the Frederick County ISEF Science for Judges, and of course, most importantly, the organizers of this incredible conference. Mental health is a global challenge, and to meet it, we need global tools. With innovations like Manasvani, we can work towards a world where mental health screening is faster, more accessible, and more equitable, regardless of where you live. Thank you for your time.